Welcome back, everyone, to CareSmartz360 On Air, a home care podcast. And my name is Ruby. I'm VP Sales at CareSmartz. And today we are traveling the globe, well, in spirit. Why? Because we have got the one and only Matt Hansen, Executive Director at Homecare and Hospice Association of Utah, on the mic. Mike isn't just any healthcare expert, he's a visionary with a passport full of transformative ideas. To inspire us to take charge of our health and well-being while also expanding healthcare access in developing nations. He has tackled everything from pediatrics to autoimmune diseases, neurological conditions to hospice care, and even emergency response in the most challenging corners of the world. Today, Matt is bringing a world of experience right here, sharing lessons from global home care models. So welcome, Matt, and thank you for doing this podcast with us. How are
Thank
you?
you, Ruby. I'm doing great. Thank you. I appreciate the opportunity.
Great. Thank you. So the world is all right now, everyone's talking about technology, everyone's talking about AI. So I want to start this conversation with AI. So how can advancements in AI and technology seem in global home care models be adapted to improve care delivery, especially in rural areas, I would say, of Utah?
Right. Well, thank you. I mean, I'm excited about AI with the rest of the world. There's a lot of hype regarding AI, and it's interesting. I attend a lot of conferences, and you go to conferences, and it seems like almost 30% of the exhibition halls are now AI now. So, for owners and operators, I'd caution them, first of all, get to know the IA and the company, because even though there are some fantastic ideas, not all of them are really ready for market yet. However, in the short term, I really do see that AI will be able to help assist with scheduling, documentation, and client monitoring, as that ties into remote patient monitoring also, and then really helping providers become more proficient. However, in the future, AI and virtual reality are also likely to provide many new care opportunities. For example, on-site diagnostics, virtual wound care, guidance, and even home safety assessments. So I think there's a really exciting future for AI, and we just have to kind of, in some ways, be patient, go along for the ride, right? But really look and I think as we visit with our peers as well, and if people are onboarding and they're starting to utilize a particular solution and can give a good reference, that's probably the best way to know if a certain service or product is ready for market yet.
Yeah, and I think, if I may, it's great. AI is great. Everyone is offering something or the other, but people should actually find the right tool for themselves,
Right.
because not everything works for everyone, especially.
It's true. And I mean, the whole concept of AI, right? It's learning. So it's learning itself in the system. So by adopting certain solutions too early, and you're too early in that learning curve, it may be that it's not providing the solution that you thought it would. So
Yeah, I agree. Let's talk about compliance for a second here. Compliance challenges Utah home care and hospice providers face, and are there global regulatory approaches that could inspire more efficient or effective solutions here?
Sure, great question. I don't know that our challenges in Utah are unique to other states or other areas. However, we certainly do have our own challenges, right? I mean, we experience them. We've received recently reports of some providers becoming complacent with infection control following the pandemic. I think everybody kind of let their guard down, right? It was so stringent, so strict to begin with, and now that we've distanced ourselves from that public health emergency, we are, from our state, at least, and from the survey team, starting to receive some reports of some complacency. Documentation is always an issue, and providing proper paperwork to clients on time also. For example, a copy of the plan of care or advanced beneficiary notice to home health clients. It's important that we're involving clients in the process, and that they're aware of the plan of care, and that we're following and really making sure that we're compliant with everything that's particular to our state. We've also received a reminder that family members who are hired by an agency to care for a loved one, they also still need to have a background check. So it's interesting. We are seeing a lot more family members being hired by provider
Yeah.
agencies with with the staffing shortages that we have. And they need to remember they're still an employee.
Yeah, you brought up a good point there. Staffing shortage, caregiver retention. Um, and that's exactly where I wanted to go next. You've traveled a lot, so you address that caregiver shortage in home care. And what are some of the lessons or advice would you give to improve workforce recruitment and also retention?
Yeah, I mean, we've seen the shortage actually get better since its peak during COVID-19 or the public health emergency. However, it's absolutely still an issue. And during the past year, inflation's probably been a bigger issue, at least for private duty home care. But looking down the road, we know the staffing shortages are going to become even more of an issue. Our state, Utah, is the youngest state in the nation, in large part because of our birth rate. We have a high birth rate, which brings that average age down. However, our population is aging along with the rest of the country. And more caregivers and healthcare professionals are going to be needed in the future. It's that simple. So groups within our state are trying to move upstream and introduce classes and job shadow opportunities for high school students. There's also been a lot of discussion in committees. I sit on too many committees. There have been a lot of committee discussions about recruiting and retention efforts. However, if someone's found that silver bullet for recruiting, I'm not aware of it yet. As a trade association or our state's trade association, we've tried to provide our members also some good solutions through community partners. I think there are a lot of different community partners, and even working with your EMR, for example, with your company, right, and partnering. That experience that employees have is huge in helping to foster retention. And then finally, more providers, as I mentioned in your previous question about family caregivers, more providers are turning to family caregivers as employees, or at least providing non-paid family caregivers with more support through training and resources.
Yeah, no, that's a good advice. Um, Definitely, it's a mix of providing technological solution and also support. And I have seen agencies uh, they have rewards programs depending on how caregivers are performing and their daily conduct and everything. So it's really there are great tools. Thank
Yeah, I think you really incentivize employees, right? I mean, a lot of those tools and what I refer to as an allied partner or community partner is would be a third-party business, all right, a vendor. But they have some great apps. A lot of them are gamified now, so it encourages engagement. There's ways that you can, a lot of people, a lot of providers are saying, how can I afford to give somebody, a gift card or to give them money and credit they can spend on a gift card. But if you look at the cost of hiring and onboarding, it's astronomically higher than it is to give somebody a gift card once a month,
right.
right? Or some type of credit in that way. It's worth the investment. It helps your employees to with job satisfaction, and it really increases that stickability as well as referrals. I mean, if our employees are happy, they're going to tell their friends, and hopefully, they choose to come and join our company as well.
Yeah, yeah, true, true. Um, just reflecting on 2024, since we are at the tail end of the year now, what global trends in home care had the most significant impact, according to you? And how did they align with the challenges and accomplishments of Utah's home care system?
Hands down, I'd say the reimbursement has been the most significant challenge, both nationally as well as in Utah. The Medicare home health rate cuts have been devastating nationally. In Utah, our HCBS waiver programs are on the brink of extinction if we don't get an increase in the upcoming legislative session. And then for the first time, CMS recently recommended a freeze on hospice rate increases following the advice of MedPAC. So in addition to insufficient reimbursement rates, I say providers have had to deal with improperly denied Med Advantage and Medicaid managed care claims, even for episodes that were pre-authorized, right? So as we've learned recently, some Med Advantage payers have actually been using AI to review and deny claims. So there is a dark side to AI as well. There's certainly other challenges, but many providers are just so busy trying to figure out how to survive that they often don't have much time to worry about or address the other issues.
Yeah, okay. And looking at 2025 now, which innovations or strategies do you predict will influence the industry in 2025? And how can local agencies prepare for these trends?
Yeah. And that's the crystal ball question, right? So, I mean, based on recent election results, I believe that things are unfortunately going to become even more difficult for Medicaid providers in the near term. For example, we're anxiously waiting to see what happens with the federal medical assistance percentage or the FMAP. However, I'm expecting positive developments as well. Bipartisan leaders have really expressed a lot of support for care in the home during the last, decade, but increasingly so, particularly during the last presidential term, or administration. But that support has to be more than just rhetoric. We need to pass important legislation like the Preserving Access to Home Health Care Act, components of the Hospice Care Act. One thing we're really excited about there is giving hospice clients the option to receive respite services in their own home. There is also the Access Act, the 80-20 rule needs to be removed. So legislatively, I think we will see some of those wins in 2025. They also predict that we'll continue to see some really cool technologies come to market, and with them, also new business models and potential revenue streams for companies.
Yeah, there's definitely good things happening, and we hope for the best.
Yes, absolutely.
Yeah. Anything else, Matt, that you want to share with our audience today? Advise them. As we're just at the final, few days of 2024, and everyone is preparing for 2025 success. What's your advice for home care agency owners?
Yeah. Thanks, Ruby. I'd say don't lose hope, right? To go back on that. The pendulum, yes, the pendulum effect. The pendulum oftentimes will swing too far this way, right? But it has to come back. Really, our officials, as well as the market itself, understand the value of care in the home. The future is in the home. I really believe that. I've never been more optimistic about care in the home than I am right now. However, there are definitely some headwinds. There are some challenges, some struggles. I think the best thing that business owners can do is to become familiar, become aware of the options that are there to help them. There are all kinds of different programs. I mean, we're working with some things with our members now with different, legislation that's been passed and with the Affordable Care Act that give different credits to businesses where they can actually save, not only provide free supplemental insurance to their employees, but it's actually a net positive because of the tax savings. So there are all kinds of programs like that. But again, people get so wrapped up in the reimbursement and claims that they just don't give themselves the time that they need to run the rest of the business, or to look at other ways that they are to mitigate those rate cuts. We also, have to be careful with how, we're addressing the rate cuts themselves. Oftentimes, I think it's a race kind of to the bottom. And by accepting lower reimbursement rates that can't sustain our businesses, but doing it because we want to be one of the only providers that's on a panel, it doesn't help us and it doesn't help the industry as a whole. So yeah, take time. We have to be business owners also and not just operators. But yeah, that would be my advice to people. Don't lose hope. Take the time that you need to make your business successful.
Thank you so much, Matt, for your advice and for coming to this podcast. It's a great content for home care operators, owners, and everybody in the industry. So I thank you very much.
Welcome. Thank you, Ruby. Happy holidays and Happy New Year.
Yeah, happy holidays to you too. Goodbye.
Thank you. Bye.